donasyon lang ng China pati sa WHO. Walang bayad yun. Ganito ang tanong ko kasi talagang apurado ang lahat naman. Meron tayo nandyan ngayon intended sa pangalawang injection kasi dalawa yan eh. The booster would follow in so many days. Yan hindi pa nagagamit kasi ang second booster ang problema niyan madali yan sabihin, how about those needing already the second dose? There's a problem there. Sabihin mo, gamitin na muna para sa first dose na hindi pa na bakunahan. Okay. That's good. But the problem is, the second dose would come from the future deliveries. Okay yan. Ang problema, ang next problem is, baka hindi dumating.
The Newsday continues here on One News Now. I'm Charles Lejano. Health workers still won't call for a timeout yet, despite the rising cases of COVID-19 in the country. To tell us why and to give us other updates on the government's COVID-19 response, we have Greg Gregorio joining us live from Mandaluyong. Greg, good afternoon. Could you tell us why healthcare workers are not recommending another timeout, even if the daily cases have breached the 5,000 mark already?
Yes, Charles, good afternoon. The Health Professional Alliance Against COVID-19 is saying that they believe that there are still other measures that we can do to mitigate the increasing number of cases. But they are saying that lockdown is still an option if our health care system gets overwhelmed again, like what happened at some point in our COVID-19 response last year. Charles?
All right, Greg, so at least for now, what are they recommending instead of a timeout?
Yes, Charles, the HPAC has a number of recommendations for the business and industry as well as for the local government units. For local government units, they are recommending the enforcement of our existing protocols like the contact tracing and the capacity and to capacitate the barangay health emergency response teams to immediately respond to cases that are in the area. And for the business and other industries, the HPAC is saying business establishments must encourage the implementation of work from home arrangements and then the staggered working hours, as well as helping the healthcare workers to adhere to the minimum public health standards. There are also other implementations that they can do, as well as to ensure the well ventilation in an enclosed area. Charles?
Right, so all of that instead of a timeout, at least for now, no? But then do we have any updates on the bed capacity at hospitals, and how are authorities planning to address this?
Charles, according to Dr. Antonia Dance, convener of the Health Professional Alliance Against COVID-19, there are hospitals in the National Capital Region wherein their ICU beds are being occupied at around 80%. But as of the latest report of the Department of Health, there is a 54% availability in the ICU beds across the country. But since they are all monitoring with the hospital occupancy rate across the country, they are also implementing the One Hospital Command System, which provides the referral network between hospitals to ensure that a patient that needs to be admitted would find a facility where he or she could be treated. Charles?
Right, so there is a referral network in place that we can rely on. But then could you tell us more about the proposed coordinated contact tracing efforts by the DOH?
Yes, Charles. Charles, actually, it's the HPAC who said that the local government units must implement a coordinated contact tracing amongst other LGUs. Dr. Antonio Dans gave an example of the coordination between the local government units of Antipolo, Valenzuela, and Pasig, where there is a coordinated contact tracing using their own QR codes that is being used by their citizens. Charles?
Right, Greg, we reported earlier that, we are hearing that localized or granulated lockdowns aren't necessarily effective. Are authorities still pushing for this?
That's just according to HPAC, instead of the region-wide or the stricter community quarantine like what we used to experience before, they are encouraging local government units to do more on localized or granular lockdowns as soon as they detect a case or a clustering of cases in their area. In this way, it could help the mitigation of the further spread of the virus in their locality. Charles?
All right, Greg, let's talk about vaccination for a bit. Can pregnant women or senior citizens be vaccinated against COVID-19? What are the current options available?
Yes, Charles, in a separate press conference this morning with the Department of Health and some health authorities, Dr. Shelly De Vega of the Institute of Aging from the National Institute of Health is saying that senior citizens are the best candidate for vaccination, especially that this vaccines would give them the protection that they need from the possible hospitalization and possible death brought by the threat of the SARS-CoV-2. And as for the pregnant women, Dr. Sibyl Bravo of the Philippine Infectious Diseases Society for Obstetrics and Gynecology is saying that pregnant women may be vaccinated with COVID-19 vaccine if they are already at the second or third trimester of their pregnancy. And if they will be having a COVID-19 vaccine, they will only be given with the vaccine if there are no other vaccines given to them at least 2 weeks prior on the day of their vaccination. The Department of Health is saying that these recommendations are also part of the recommendations of our experts in the ongoing immunization of the country against COVID-19 vaccine. But they are also highlighting that those pregnant women who want to be inoculated with COVID-19 vaccine must belong to the priority sector, which is the health care professionals, and they should also seek clearance from their physicians before having the shots. Charles?
All right, Greg, we are halfway across the month of March and Holy Week is coming up. Do we have any reminders from authorities as regards the observance of Holy Week?
Yes, Charles, the HPAC is saying it is still best if all of us will just stay at home in celebration or in commemoration of the Holy Week. But if people are really would like to spend time with their family outside, they should choose open spaces like beaches where there is an open space. But they are saying that LGUs must make sure that the number of individuals in an open area is still regulated. Otherwise, this would still look like an enclosed area if the numbers of individuals are unregulated. Charles?
Thanks for that, Greg. That was Greg Gregorio reporting live from Mandaluyong. Former MTF Special Advisor Tony Leachon says the granular lockdowns and uniform curfew imposed by local government units are ineffective against curbing transmission. In an interview with 1PH sa Totoo Lang, Leachon says cases have been surging despite forced granular lockdowns and nighttime curfews. And he adds that a more effective approach would be to place the entire metro under MECQ at least for 2 weeks.
Kung sasabayan ng MECQ, tapos pangalawa, testings and contact tracing, isolation and quarantine. Tapos ipalabas ka agad yung results ng variants, madalian. Tapos aralin natin mabuti itong cases na marami nating kababayan at saka susunod lahat ng tao sa minimum health standards. I think masosolve natin ito in 2 weeks eh. One time, big time lang na sacrifice mga kababayan kasi malapit na po tayong magkabakuna and I think ito yung bridging concept na naiisip natin. Isang 2 weeks lang po na paghihirap po mga kababayan sa ekonomiya and I'm sure makakaligtas tayo pagdating na ng bakuna.
Meanwhile, the Philippine College of Physicians says there's no need for the health sector to ask for another timeout just yet. While critical care occupancy and admission rates have been increasing steadily with the surge in infections, Dr. Maricar Limpin says that the healthcare industry is still managing the situation. But the health department warns that the sector may eventually become overwhelmed if the increase in transmissions remains uncontrolled.
We will need the timeout if we don't change what we're doing now. So we've seen na naghigpit na po yung LGUs, that's good. We're seeing less people going out. We've seen establishments going back to, sige, work from home ulit yung mga tao nila, no? So these efforts, we're hoping, will add up to the positive response, no? Para mag-plateau na tayo.
Local government units in Metro Manila are strictly implementing curfew hours and other anti-COVID measures in their cities. Some curfew violators in Manila were asked to do physical exercises this morning by the Manila Police District. Minors found outside their homes during curfew hours were rescued by authorities, while adults were apprehended and were required to attend lectures on COVID-19. In Santa Cruz, Manila alone, some 68 of last night's quarantine violators were identified as minors. The police said parents who allowed their children to leave their homes past curfew will face charges. Meanwhile, activities at the MPD Station 11 have been suspended due to COVID infections among its personnel. In Quezon City, the number of areas under granular lockdown has reached 26. The Quezon City government claims that the recent COVID-19 infections in the city were most commonly transmitted in the workplace, and the infections in the workplace were then spread to households when the infected employee comes home from work. And vendors or stall owners in Pasay City's public market are now required to undergo a swab test before resuming operations. They will take COVID-19 tests at the mega swabbing facilities of the Mall of Asia Arena.
When we see these alerts occur, it shows that our systems are working, and that's a good thing. Well, we know that there's been some people who have presented with blood clots and other blood conditions following the receipt of their vaccine. Conditions like this are not unanticipated. There's going to be a raft of conditions we expect to see occur after vaccination just by chance because they're happening all the time in the background anyway. It's what you might call a signal or an alert, which means you go looking to see if there's any reason to think that these are going to be causally related. There's a number of assessments that occur, and that should sort of happen quite quickly. And then after those, you further reconsider whether you need to go further and more investigations required. That's a really hard question because what we're seeing here is an abundance of precaution. Nobody at the moment thinks that this is caused by the vaccine, but they wanted to be very cautious anyway. Some of these countries have a lot of COVID, and COVID itself, of course, causes blood clots, etc. So you have to be very careful because it's also sending a message that there could be something very wrong with the vaccine when in fact it's very unlikely that there is. There's been an enormous number of people now that have received this vaccine, tens of millions of people. And we're at a stage where we need to appreciate that these things are going to keep coming up. We're doing mass vaccination campaigns and people get sick all the time. We can't panic every time it happens, but we also need to take all precaution. It's a hard balance.
On to some entertainment news. We might still have some of that Grammys hangover, but the Oscars are here with its early nominations. Netflix's 1930s Hollywood drama, Mank, led Oscar nominations on Monday with 10 nods. That includes nominations for Best Picture, Best Director, and nods for actors Gary Oldman and Amanda Seyfried. The Oscars, the highest honors in the movie industry, will be handed out at a ceremony on April 25, and this will take place at both the Dolby Theatre in Hollywood and for the first time at Union Station in downtown LA. But the actual form and flow of the ceremony have yet to be announced, and notably, this year's nominations were packed with firsts, as 9 of the 20 acting nods went to non-white performers, and the record 76 nominations were bagged by women. And for the first time in the 93-year history of the Oscars, 2 women will compete in the 5-person Best Director race that has long been dominated by males. And those are the top stories of the hour. Join Sean Yao later at 2 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Register for a free account at www.signalplay.com so you can stream One News live anytime, anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We're One News.